2024 Sharp Information Session, where we invite speakers to offer information sessions about resources, services, and tools available to help English-speaking seniors to age in the right places. My name is Erica Botner. I'm the program manager for seniors and the Sharp program at CHSSN. I'll be your facilitator for today's session. Today we have Vera Granikov, who's a postdoctoral research fellow working with the CHSHUM, and also who did some research with the Atwater Library, who's here to talk to us about libraries and health literacy and how they can help us with aging in place. And you hold a PhD in information studies from McGill University and bring 16 years of experience in health information and patient-oriented research.
So thank you so much, well, for inviting me. And it's really, I'm excited to be here and to talk about a topic that I love talking about, and that I think is really important. Also just, well, our health is important to all of us. And often I know people will talk about health information, especially health information on the internet, and how it makes us anxious when we look for it and just increases worry. And I always say, like, it makes so much sense because our health is so important, and it's normal that this is something we worry about, but we can be, I think, better equipped to navigate all the information out there. And that is what I will try to share with you today. This is a little bit the plan. So I will introduce myself and kind of how I met Erica and why I'm here. I will then talk about health literacy, really explaining, well, like what it is, why it is important. And I will share with you some practical tips that I hope can help you in navigating health information. I will then talk about libraries specifically and just the resources that are available and can help you both in managing your health and the health of people around you, but also how to age in place. And I know I am also connecting from Montreal today, but there are resources that either Montreal libraries make available online. And I will also encourage you maybe to reach out to the libraries in your areas to see what services or activities are there. So this is just to start, my connection with the Atwater Library. So actually, I used to volunteer with them a long time ago when I was a master's student in library school, and I reached out to them for my research project. The Atwater Library is a really special place. So here you have pictures. I don't know, for those of you who have never been or don't know about it, it's a library that was part of the Mechanics Institute that was really a movement in, well, like the colonies, were based on the belief that all these mostly men who would work in factories during the day, but that they should learn and then be enlightened in the evenings when I'm hoping they weren't too tired to learn. And the Mechanics Institute actually predates even McGill University. And it had this mission for adult education and community education. And in addition to providing, books or newspapers, there's also a lot of group learning and workshops and kind of this, even back then in 1828, but this idea that we could learn so much if we learn together and from each other, which is really at the core of my research as well. And kind of, if we fast forward to today and the kind of more current reason of why I reached out to that for library when I had funding to do my research is because they have a project that's called Connect Digital Literacy Project, and was an initiative to help mostly seniors become more familiar and just to have a space to talk about technology, digital literacy. So one of the activities they have is this weekly peer cafe where people can show up and ask questions. It could be, how do I use, my iPad that I received as a gift, or is it safe, for example, to put my credit card into Amazon and shop online? So it's really a space where people come with their questions, and everyone learns from the questions, but also has an opportunity to contribute to the answers. So when I wanted to do my research, I thought, well, this group may be interested in what I'm trying to do, because what I'm trying to do is to do that kind of what a library is doing about digital literacy, but to do that about health information, and really based on this belief that we could learn together and from each other, but how to think critically about health information. And the image I have here of this braid is really because for me, kind of my project is about bringing health literacy that I will define in a moment with collaborative learning or learning together and community engagement. So I really wanted to co-design a project and activities with the community that made sense to the people that I was going to be doing the learning together. And that's, I believe, how Erica heard about me and invited me to talk to you today. So what is health literacy? Fundamentally, it is our ability to access or find health information, understand what it means, hopefully understand that it's not full of jargon and very technical terms that are not easy to understand, evaluate it. So really think, critically, is this trustworthy? Is it not? Sometimes, and ideally, some of it is black and white, but there is also gray. So kind of how to navigate that, the critical evaluation aspect of it, and then use the information as well. And when I say use, it could be using it, how you manage your own health condition or how you take care of a loved one. But it could also be used in how you communicate with, for example, your family doctor. So when in that encounter, do you feel informed and that you could act on the information that, for example, you found? And this is what we call, and it's true, I recognize that I'm using jargon too, what we call health literacy, but these are also the main aspect of information literacy. So it's really whenever we encounter any information, it could be legal, anything. These are kind of the main blocks, is finding it, understanding it, evaluating it, and acting on it or using it. So this is just to go more like what health literacy includes, so there is like what we would call numeracy, numerical literacy. It's really how we understand numbers, and it could be statistics, but it could be even just the posology on our medication. So understanding how many pills to take when, that is important. There's also just the basic reading skills that are part of it. So it will come in, for example, that we understand the information pamphlet that we may receive at the hospital before surgery, that we can read and understand, decode what they're trying to tell us. There is also this whole like social aspect of it. And this is often because, well, like we take care of ourselves, but we also contribute and often take care of the people around us. Or, maybe we don't take care, but people will turn to us with questions. So it's definitely like health literacy is a social practice. And also in some ways, for example, as in what I described to you about my own bone situation, I rely on my partner to help me manage that information. And I think it happens to all of us that in a way, having people around us can help us overcome our own health literacy challenges in that moment. Then there's communication. And this is very much how we talk with people close to us, and very often how we talk with our health professionals, and how they talk to us and how they listen to us. That really comes, well, I'm sure you have experiences where you lived that, and you know how important it is to be heard by the health professional, or even just have the time to really explain what your questions and concerns are. And it's also, health literacy is on the level of our institutions also. So it is, yes, there is the individual encounter maybe with your doctor, but it's also how the hospital communicates in general, so it could be pre-surgery pamphlets, or really anything else, any other information they provide, or just their awareness that people may have lower levels of health literacy and communicating in a way that makes sense. And then all, of course, right now there is, and kind of going back to that water library, there's the digital literacy aspect of it. So it's having access to devices, whether it's a computer or a phone, having access to the internet, because so much kind of we're so dependent on having this to even connect with our health system, and how to knowing how to use these devices. And the example I always give is about blood tests. And I feel how before you just have to, you had to show up at the hospital, and maybe you would spend hours in that waiting room, but you would come out with a blood test done at the end. And now there's a whole process where you have to go online, you have to figure out how this interface that I'm sure was designed to be useful, but I don't think is always or for everyone. You know, that the digital barrier is there and is very important. So today, in some ways, how our world is becoming more complex, that health literacy as a definition is becoming more complex as well. Why is it important? So it was demonstrated by research, and has been demonstrated for a long time now, that when we have lower levels of health literacy, the negative health outcomes go up. So this could be, for example, like misunderstanding how to take your medication or how to prepare for surgery. It also has been demonstrated that people end up in the emergency room more often if they have lower levels of health literacy, or they have return visits to the emergency room. So means they went home, but they have to come back. And of course, these are negative outcomes like for us as individuals, but there are also associated to costs for the system that could be potentially avoided. So this is now, I wanted to ask you, and please type it in the chat, is how do you look for health information? And also if you could say, what do you find difficult about finding, and you could think about the 4 aspects of health literacy, of accessing or finding, understanding, evaluating, or using health information.
Somebody said, I use Google and then I look at the source to make sure it's safe to use. Mayo Clinic.
Yeah.
Mayo Clinic.
Yeah.
Educate-moi. NIH, the National Institute
Yeah.
for Health. Google, Dr. Google, asking resource people like nurses, etc. INESS, the CIS, Health Canada, doctors, specialists, Google, safe sources like Mayo Clinic, the drugstore.
Oh my God. Yeah. The pharmacy is an amazing resource, and kind of in the community. They're there, they're available. We don't need to make an appointment on a complicated online system. And there are definitely, pharmacists are great community resources for health information.
We've got a few others. We've got Info Santé,
Yeah.
online, Health Canada, Mayo Clinic, word of mouth, and GP, so general practitioner, doctor. I go online to Mayo Clinic, but do not solely rely on this totally. I seek medical advice from health professionals.
Amazing. Yeah. So maybe it's true. So just now that I took the temperature of the room a little bit, some of what I will share with you today may be familiar to you, but hopefully it will be a useful reminder. And as I always say, it's okay if we don't learn, like, I feel often there's such a focus on learning new things all the time, but I think it's also okay not to learn new things, but to be validated in what we already knew, or just to know that we're doing the right thing already. So just to talk about kind of the possible solutions to this. So of course there is our individual health literacy skills, and just it could be in engaging in conversations like today, but then also using some of the trustworthy sources, that you listed as well and shared in the chat. There's improving communication skills, and it could be for us, how we communicate with the doctor, knowing that we have only 5 minutes and we could address only one problem. but it is definitely how the health professionals communicate with us and how they listen and also how they explain to us. And I feel, or at least, yeah, that it's an area that there could be a lot of improvement done, just to explain to us what is going on and also treat patients like capable, intelligent people who can understand complex things. Pro-health literacy organizations, so that's really a movement, and it's a little bit that our hospitals or clinics or pharmacies as organizations need to be aware of health literacy issues and should be putting things in place to become better at serving their communities. And of course, we can change things at the level of the government. You know, for example, the ministry can make sure that all health professionals or organizations have training in clear and simple communication. And mostly what I wanted to share with you, and it's kind of my view of this, that it is our shared responsibility that, yes, I think as individuals, we could work on self-improvement, but it's not just up to us to do, in a way, all the work to contribute to the whole. We did research, we did interviews, we did focus groups with people to understand. It's a little bit like the question I asked you earlier is, what do you find difficult? So that's what we ask people is like, where do you struggle? Where would you need help? And the areas that came out is that we want help to search, to evaluate, and use information. And this is also on this website, there is a section that's called useful websites, which is a list, you know, and while kind of our philosophy in building this was a little bit like the story that instead of teaching people how to fish rather than giving them the fish, but we totally understand and we heard it over and over that people also just want the fish. So that's why we, you know, provide tips and guidance for how to do things, but there is also a list of various other websites that are trustworthy sources. So this is a site that you could go to. And I will share some of tips with you today about how to search to start with. And this is, maybe it is completely familiar to some of you, but just to make sure that we're all on the same page and that we understand these words the same way. So web browser is the application or the software, we could say, that helps us access the internet. So it could be Edge for Microsoft, Safari for Office, or Firefox or Google Chrome, that's across, regardless of what type of computer you use. The search engine and Google, that, for example, is the one that came up in the chat and is definitely probably the most popular one, is how we search. So it's not, Google does not contain content, informational content, but it helps us find content. So there is Google, there's Bing, that's also a Microsoft product, or there's DuckDuckGo, which is actually the one I use and my friends call my stupid search engine, because it doesn't track you as a person. So you actually have to put a lot more information in the search box to find what you're looking for, but it doesn't keep any of the history on what you have searched before. And then there's the website, which is the informational content, you know. So for example, here I put Medline Plus, which is a resource from the US that provides health information on all sorts of topics, or we have the one from the Alzheimer's Association of Canada. So these are just the terms that I will be using. So first, like, how does Google know or understand exactly what we mean and give us exactly what we want? You know, because sometimes that could be the sense that we get when we search. Well, like, we don't know because it's a corporate secret and they don't want us to know how they actually do it. But what we do know is that the process behind, so like when you search for something and the results come up, the results that you will get are based on ranking. So how many other pages are linked to the page that shows up at the top? So a website that is linked to by many other websites will show up at the top. It is also, the search engine will count how many times that exact word that you put in the box appears on that website. So once again, it will move it to the top as, you know, your top results or hits that come back. But it also takes into account your personal context. So like where you are, what device you're looking, and also what are all the other things you put in that search box before. So, and why is it important? It's important to keep in mind because if you and I put the exact same words in that box, for example, in Google, we will get very different results. So what will show up on top for me, suggesting that these are the best results, may not be at all what shows up on top for you. And I'm bringing this up just so like we are, the way the search engine is designed, like we're not talking about objectively good results, you know, because kind of what's suggested to me as good results may be different than what is suggested to you. This is a tip that I wanted to share with you that is a way to focus your search or get fewer results. And this is actually, it's interesting. I assisted a talk yesterday that was, well, like talked about our resilience in dealing with information online. And more we're talking about information overload. So yes, there's misinformation or disinformation, and kind of there's a lot of information that is, you know, of questionable quality and potentially dangerous. But there's also just the fact that there's so much information. So kind of discerning is becoming harder and harder. So one way to get it is to narrow down how many results you will get is to use quotation marks, or what we call phrase searching. So what it does, that it will force the search engine to look for the exact words you put between the quotation marks. So, and here the example that I'm showing you is I looked for osteoporosis treatment as just regular 2 words or as a phrase in quotations, and the number of results is very different. So this is a way, just a very kind of quick and easy fix to get fewer results that come back, is to force it to look. And you could put as many words as you want, as long as they're inside the quotations. Also, this is probably, you're aware of this, that there's also advertising, and there are lots of people who are interested in selling you things. So whenever you get back your search results, just be aware. And you could look for, you know, little signals, whether it's sponsored or that it is an ad, just that their intention, their primary intention may be selling and not informing you with trustworthy information. There are different types of websites. So you could have organizational that are by patient associations or hospitals. They could be personal. So it could be a doctor publishing their opinion on something. And there are also social forums. So it could be parents or patients exchanging information based on their lived experience, or also information that they found somewhere else. And my intention here is not to, you know, rank them or prioritize them or say that one is better than another, not at all, you know, because in a way, in each category, you could have trustworthy or more questionable information, but just for you to be aware of this when you're faced with information. Is kind of like who's behind this and what type of information it is. And what I always say is kind of be like a journalist and think about the 5 whys and think about the questions, the who, what, where, why, and when. So for the who is the author or the sponsor, you know, and is it easy to tell? So here you have the example of the different endings for the URL. So once again, it's not to say which one's good, which one's bad, but just it's something for you to pay attention to. And always look for an About Us section, and hopefully what is written there will actually be helpful in deciding whether it's trustworthy or not. The what information is presented is, again, like, what is this? Are these facts that are based on science? Are there opinions? Are they lived experiences? Or are there really people sharing, in a way, their values and ideologies? And it's not to say which one's right or wrong, but just to keep in mind, what is this information? And if these are opinions, you can ask yourself, well, like, whose opinions are they? And also, are the people, whoever is sharing it, are they transparent in saying that this is my opinion rather than presenting it as objective facts? Where is this coming from? You know, so is it based on science? Is it journalism, opinion, lived experience? You know, what are the authors talking about? And why is it there? What is the purpose? You know, is it, well, like to sell, to who's funding this, but also who is it designed for? You know, because sometimes we may come across information that is actually written for health professionals that may be harder to understand for us, once again, because there's jargon or more technical terms that are used. So it's kind of why is it there? What is the purpose? When it was updated, usually you will see that at the bottom of a website. So if you scroll all the way till the end, you will see the date. And because we're dealing with health and there's research being done all the time, kind of there is new information that is available, so it should be updated more frequently. And if you're looking for something very specific health related, I would say try to look for the latest information possible. This is something, what I always say, like, to proceed with caution, beware. These are the red flags that I talk about. Like, is this an advertising? And it could be for pharmaceutical drugs or herbs or dietary supplements. So people trying to sell you things. Also, some of this, just in terms of language and choice of words, if people are saying this is non-toxic, holistic, miraculous, and as much as we often, I understand the desire for miraculous treatments, but this is just kind of, for me personally, when I see words like this, a little red flag goes up to proceed. It doesn't mean that it's wrong, but just proceed with caution. Also, statements like everyone should take this, or this is 100% effective, big red flag. How do you know? You know, like, based on what can you make such a big claim as the author of the information? Sometimes they'll say, you know, scientific research found so and so, but there's no reference. So there's no way for you to kind of track it back to the source. Sites that don't have a clear or transparent editorial process, which usually you would find in the About Us section, and personal websites, you know, so even if someone is a doctor or claims to be a doctor, it does not mean by default that the information is correct and trustworthy. And this is just to give you an example, and this is, yeah, like, we're back to my bones. You know, overcome severe osteoporosis, the superfood builds new bone. You know, and here, like, it does actually say that it's an ad, but it's that kind of language that, you know, like, we want to believe, but we should also be kind of proceed with caution. And this is just because we're talking so much about AI and ChatGPT or Copilot, you know, and maybe I'll actually start on the right-hand side. It is a little bit like Google in terms that it's a black box. Like, we don't know exactly what's inside, how the algorithm works, or even what the data that trains it is. And what the quote you have here is actually what ChatGPT replied to me when I asked for references, you know, so a little bit like with the 5 W's that I shared with you, I wanted to know where the sources are. And the ChatGPT said, like, well, I don't know what I was trained on. And I can't provide sources, but I could give you general references. So we don't really know that what it is giving me, if it's actually connected to the general references it will provide. And because it is trained on data, we don't know what that data set is. However, there are definitely good sides to tools like ChatGPT. And for example, you could use it to simplify the language, you know, so if you found something and it is written in using technical terms, or it's just confusing, you could ask ChatGPT to simplify. You can ask it to translate also, you know, so whether it's for you or to share with someone who may speak a different language. It could be useful for this. Could be useful to summarize also. So for example, you could take information that you know is accurate and put it in there. And just like how we could ask it to simplify the language, but we could also ask it to make a summary. And maybe ask it to explain things. You know, of course, like take all this with a grain of salt, but it's also, I do think that there are some very important uses to this tool, but again, just be aware of the potential negative aspects. So now we're going to move to the last part, which is really about libraries and the role of libraries. So this is, we know, and there's research and just stories of people that libraries could play an important role in public health. And they're often considered to be or information resources that people trust. And it's a safe place to come and ask questions or find information. So libraries could be used for providing health information, also have various educational programs, activities, for example, to reduce stress, reduce social isolation, which we know is important and affects our health and well-being, and promote healthy eating and food literacy. So these are just some examples of programs that libraries may offer. Of course, I know that you're connecting across the province, so I don't know what your library offers, but these are just ideas that maybe you could go to your library and ask them. But just so kind of my intention was to open up the the Pandora box, or open up the horizons, that libraries are so much more than just books on a shelf. And sometimes we may not think of other kinds of programs or activities or support that they may offer. And this is, I'm not sure how many of you are familiar with the Atwater Library. It is based, it's in Montreal, but they offer a lot of programs and activities online as well. And this is just a screenshot off their homepage. And they also have online, like electronic books. So even you don't need to be in Montreal to benefit from what they have to offer. And I definitely encourage you to check out their website and see, what may be useful to you. There is also the Grande Bibliothèque, or the BANQ, so the Bibliothèque Archives Nationales de Québec, that also have online resources. They have access to databases and also electronic books, and they have electronic books or audiobooks in English as well. So I believe you could get a membership even like also online. So in a way you could benefit from their services without going there physically, if that's not available to you. And finally, this comes sometimes as news to people, some people, that hospitals also have libraries. Not all hospitals, but many hospitals will have libraries, and many of them will have resources for the patients. And they love helping patients. So this is the one I'm sharing here, is the one from the MUHC, so the Glen site in Montreal. This is the picture of what they actually look like. They're on the ground floor of the hospital. Everybody is welcome. So you can literally walk in and ask your questions, and they will be happy to help. You can also call them or email them. And I know this because in the context of my project, Julia Kleinberg came to talk to our group, and she's, they're very, very open to people reaching out for help without physically coming to their space. And she said that they would even help with, for example, if there's an article that you're interested in, because often articles are published in paid journals that we can't access, but they can help you access them. And other hospitals have libraries. For example, the CHUM has a library. the neuro in Montreal has a patient resource as well. And kind of instead of giving you, well, actually, I believe if you go to the patient portal here of the MUHC, they will give you a list of other patient resource centers. But it's mostly just like with the rest, it's to kind of make you aware that these resources exist. Maybe not in your region, but the ones in other regions may still be able to help out even, well, like online without physically being there. And this is to kind of close up just what I'd like to share with you. These are from the IFLA, which is an International Federation of Libraries. And it's always consider the source, read beyond, you know, so often like we start reading and maybe we're outraged or scared or whatever, but read till the end, kind of be thorough in how you read, check who the author is, look for supporting sources. So often, you know, I talk about like I train my kids to think about triangulation and kind of look for at least 3 different sources in different sources, you know, like different types of sources, and to see if they agree or not. Check that, and also if they don't agree, doesn't mean it's wrong, but proceed with caution. Check the date, look for the, like, is it a joke? Is really about the purpose, you know, is whoever is communicating or sharing this information, is it serious? Check your own biases, and we, you know, we all have them, whether we know them or not. And ask the experts, you know, so talk to a librarian or talk to your health professionals. Get to know your local libraries. I'm sharing with you mine in Point St. Charles in Montreal, but it kind of, and I guess I put the slide because I'm not, well, I don't know where you're connecting from, and I don't know all your areas, but just reach out to them and see where are they, where are the branches, what do they offer online or on site. Also, there's this movement called Library of Things, where you could actually borrow things, you know, so my library that decided to kind of specialize in being analog, so you could borrow like VHS machines, you know, and watch old VHS tapes. But often it could be things for knitting, it could be musical instruments, it could be tools for the garden, all sorts of things. So really, especially connected to, well, the theme of aging in place, you know, there may be free things and resources out there available to you through your libraries. And also, just so you know that there are other types of libraries, for example, hospital libraries that may be able to help you. Eric, if I could just add that I think some of these, like the red flags or the questions, are applicable to all types of information, not just health information, and also not just information online. You know, whenever we read something in a book or in a newspaper, we can use the same critical thinking.
Absolutely. There's so much information now, right? That it's really important to know how to filter it. And on behalf of all of us at CHSSN and all of the organizations that are here today, we want to send a huge thank you to Vera Granikov for the time that you spent with us. I think we're all leaving a little bit more informed and empowered. And hopefully we're all going to connect with either our local or some kind of virtual library.
We could see it as a burden, all the work that we have to do, kind of that the burden is on us, you know, to be informed or keep a binder. But we could also see it as empowering, that in a way, this is an area where we have agency and we can do it for ourselves, and we don't depend on someone else doing it for us.
I want to thank everyone for being here this morning. I hope that you'll share with someone else what you learned here today to make even more people informed. So
Wonderful.
thank you so much. Again.